Well, I've been a veterinarian since '86, but I've done mobile work probably the last 12 or 13 years. Because I don't have a clinic, so this is my office. This is all my X-ray equipment and drugs and surgery stuff. Extraction tools in there. He's frisky this morning. I try to be self-contained because it's never know where I'm going to be. And I've done horses out in the middle of a field before. And this stock allows me to have a safe place to work on them, and I've got all my tools. Dr. Stubbs, who designed this stock, is in Johnson City, so he's just an hour that way. And I know of another veterinarian that has a sort of similar setup up towards Temple. And there's another one in Georgetown who has a different mobile stock. But yes, so there's several in the area. All of their cheek teeth actually go up to the base of their eye, so my hand is going up very far back in their mouth, which is one of the reasons why I've got to use a full mouth speculum, and I've got to have some sedation on board to allow this to be safely done and completely done. So I would not want to put this apparatus on a horse because they can both injure me and injure themselves with improper use. And so I don't know how you're able to look in the back of the mouth with the tongue moving without sedation and without a full mouth speculum. It's just too far, too big a tunnel to go down and say I've really looked at every part of the back of their mouth. And I'll be looking with multiple tools. I'll be looking with a mirror and with explorers. And I need to have the sedation on board to be able to allow me to do that. So I'm just looking visually again for any kind of sores, sharp edges, any places where there might be signs of periodontal disease, abnormalities. So there's no sores on his mouth. He's got a little bit of edges on his teeth. I'm going to keep those there because I want him to have those to be able to chew with. So I'm just going to take away a little bit of height, and you have to be careful. Again, I want to take 3 to 5 millimeters, no more than that, on these tall teeth, so that then he doesn't have any risk of having any irritation to the opposing gum. Now I'm going to look at the chewing surface of all the teeth and the gum with this mirror, so I can look at every tooth all the way to the back. They have 24 cheek teeth that I need to look at. I take this explorer and go along the chewing surface of all the teeth and rub where all the pulp horns are to see if there's any kind of pulp exposures that can happen due to just wear and tear of the teeth. And that can lead to infection that goes up into the roots of the teeth. So I want to try to prevent problems by evaluating and catching these problems early. And he's remaining nice and quiet because of the mild sedation that he has on board. So, but he's very routine, nothing abnormal. So he's got some just sort of common points on the outside of the upper teeth and the inside lower teeth. And that's about it. I'm going to lower him down, give him a break before I start working on him. And I like to feel all the teeth again to really make sure. I guess when I was first taught, I did everything by hand, and I did a lot more by feel. And so I still depend on that a lot. So there's still a sharp edge back over on this side that I need to take care of, and a little bit on the last lower tooth. He's done now. Because I think that there's overfloating that's being done. This horse needs to have pain management. I mean, and we're at the point now where we really need to be having that part of our protocol.